Hi everyone, my name is Zhao, and I'm a research associate with ECHO based at University Health Network, which is in Toronto, Canada. I'll be speaking on behalf of myself, my co-author and the fellow panelist, Dr. Maria Milopoulos, who's a scientist and associate director of training programs at the Wilson Center, a center dedicated to the advancement of healthcare education and practice through research. Together, we wrote a paper called "What Role Can Education Play in Integrated Care?" And sneak peek, a really big role, lessons from the ECHO concussion program, in which we argue that the ECHO model is a novel digital health solution that uses technology-enabled learning to facilitate, support, and model integrated care education. And it was also a way for us to expand and contribute to the ECHO literature by creating a link between the ECHO model and integrated care. So what is ECHO? For those of you in Ontario and Canada, and perhaps even globally, you might have heard about this program. So ECHO is an acronym that stands for Extensions for Community Health Outcomes. It's a model for health professions education where we use digital health, and in this case, Zoom, which you can see kind of small on that far screen in the picture there, as a means and platform for education sessions. This model began in the United States by Dr. Sanjeev Arora for hepatitis C management in 2003 and has since expanded globally to over 60 countries and over 65 disease and non-disease other topic areas. In Canada, we started the first ECHO program in chronic pain and opioid stewardship at University Health Network in 2014. And since then, there are now over 35 ECHO programs in across 6 provinces in Canada, and ECHO concussion started in 2019. Now, how each ECHO session works is kind of what you see in the photo here, which is a live shot from inside our hub room, back when we could still be in a room together. So ECHO uses a one-to-many model where we have our academic specialists. So these are people who are physiatrists, neurologists, pharmacists, chiropractors, etc. And they work within usually an academic hospital, and they connect with healthcare providers across the province, in this case, Ontario. And our ECHO Concussion Hub consists of professionals across 9 different health disciplines, including medicine, pharmacy, physiotherapy, and occupational therapy. And not only this, our learners are also reflective of this multidisciplinary hub, attending from over 15 different health professions, from physiotherapy to family doctors to pharmacists and nurse practitioners in the community. And we've also had a few social workers as well as health psychologists attend our sessions. So each ECHO session offers CPD credits and is at no cost to the learner. Each session includes a didactic portion, which is usually around 20 minutes, and this includes a Q&A at the end, where oftentimes we'll open it up for the community, as well as, and this is on a set topic in a curriculum that we have approved at the beginning of the cycle, and then we also have a patient case presentation from a clinician in the community. Even though our clinicians often come because they think that they want the learning from the didactic sessions, oftentimes what we find is actually the learning occurs really in the discussion around the patient case. And that's really an opportunity to think together about a real patient case and discuss management options. At the end, the clinician is then provided a list of recommendations that our community and our hub team come together and generate. So we found that ECHO improves clinicians' knowledge, confidence in management of complexity and different patient cases, as well as developing a community of practice. So what does all this have to do with integrated care? What we observed in the integrated care literature was really a lot of discussion around the development, the implementation, the evaluation of integrated care programs, and even, really conceptualizing what is this topic and what is this space. But we didn't really see a lot of discussion around education of the healthcare workforce to be able to enable, support, and sustain integrated care once implemented. And even though ECHO isn't a program for integrated care or about integrated care per se, although I think there are some discussions with the Ministry of Health in Ontario around developing an integrated care ECHO, we did see many relevant links between ECHO and integrated care that we wanted to highlight. So this is a framework that I'm sure many of you are familiar with, the Rainbow Model for Integrated Care, that Valentine et al. Developed. And we really kind of saw these different levels of integration. So from clinical to professional, organizational to system, as a way of scaffolding how education might play a role in integrated care. So on the micro level, there's clinical integration, which is a person-focused perspective to improve someone's overall well-being and not just focus on a particular condition. On the meso level, there's professional and organizational integration. So that's the extent to which services are produced and delivered in a linked up fashion, as well as development of interprofessional partnerships based on shared competencies, roles and responsibilities and accountability to develop a comprehensive continuum of care. And then in terms of system integration, that's really the approach to enhance efficiency, quality of life and care, and satisfaction through vertical and horizontal integration. So this is really where we actually started to operationalize how exactly would ECHO as an education program really meet and interact with the integrated care model. So on the micro level, what we really saw was, in terms of clinical integration, the clinical integration really occurs through case-based learning, and this is through the patient case discussions that happen every week. So when a clinician from the community comes and presents to us a complex concussion management case, where perhaps this person, if they are a youth who is now coming in with multiple concussions and they need a plan for going back to school, the discussion that unfolds around is really around this development of adaptive expertise. And what this is, what this term is where learners develop from productive where learners benefit from productive struggle, as well as the emphasis on whys. So the integration of basic and clinical science and what ifs. So this is the variation in different clinical presentations. Clinical integration occurs when learners move through productive struggle together and come to us beyond a single solution, developing a nuanced understanding of patients and their contexts of where they live and where they have to, and their communities, which can be achieved through just a single discipline. If you remember back, the ECHO Hub is oftentimes multidisciplinary, representing many different health professions, as well as the learners who attend. In terms of the meso level, so this is on professional integration, there's development of professional networks between clinics, as well as development of empathy, something that we've heard oftentimes from our focus groups and from qualitative research with our ECHO participants, is that when a clinician, so say for example, a doctor, hears about how a pharmacist in the community might manage a particular case and how they approach certain modes of asking around management and diagnosis, that really a deeper understanding of what each profession does helps foster this development of empathy. And the same for when a pharmacist listens to a nurse practitioner or clinician or a physician talk about how they might approach a particular case. That's also development of interprofessional collaboration as well as empathy. And now also, interestingly, in terms of organizational integration, this is where development of the specialist generalist occurs. And the specialist generalist is a term that we use and it's defined as the ability to support care for a wide range of patients in primary care settings. So you can think about this as the family doctor who's seeing not only the concussion patient, but also the chronic pain patient, also the Hep C patient, also a patient who's a refugee coming in and a newcomer to Canada. So these are all different pieces that come together on perhaps the same patient. And also a development of stronger interprofessional networks within their own clinics. So in Ontario, there are many different primary care models, and many of these are centered around interprofessional teams. So this includes a family physician, a nurse practitioner, a registered nurse, pharmacist, perhaps an in-house psychiatrist or other medical specialists as well, oftentimes dietitians, OTs, and PTs, or sorry, maybe not PTs. And then all of these are then come together and again, talk about the same patient, and they're able to work together in a stronger, more coordinated fashion. And then finally, in terms of macro level, the system integration, the education that providers are receiving. We really kind of cut across between primary care to quaternary care. And then through the establishment of lateral peer-based networks focused on population level health, this is where we see system level integration occurring. So just finally, one last point about integrated care education. We really think about this as the meaningful learning that purposefully supports collaboration and the development of adaptive expertise in integrated care. Again, the conversation that we think is occurring within the integrated care space is incredibly important and so useful in terms of the development, evaluation, implementation. But what we see is lacking is around this piece of, okay, how do we educate the healthcare workforce and perhaps the healthcare managers and administrators to be able to support and sustain the important work of integrated care? And then finally, a definition for adaptive expertise, which is a framework for conceptualizing how expertise develops as both procedural knowledge, so knowing what to do, and conceptual understanding, knowing why you're doing it. So again, this comes back to this idea around productive struggle and emphasis on whys and what ifs. Thank you so much, and we really look forward to the discussion.